people with autism are often measured by the same standards. At least, that's what experts thought until recently. That is wrong because now we know that the autistic spectrum has many faces. The disorder can manifest itself very differently by different people, but also it can change by the same person during the course of life. The mystery surrounding this condition is slowly being cleared up by clinicians and scientists over the last years. And today I will clear up the most contemporary insights about autism. I'm a healthcare psychologist and therapist, and I make videos on psychology and mental health topics. If you are new here, don't forget to subscribe to my channel and hit the notification bell so you don't miss any of my new content I publish every week. Autism is a developmental disorder that usually becomes apparent before the age of 6. Children have difficulty with communication and social interaction, and they display stereotypical, repetitive behavior. What does that mean? They make little to no eye contact with their parents and teachers. They don't like to share their interests and joys with others, and do not use facial expressions and gestures to establish contact or smooth conversations. Furthermore, they have difficulty defining the mood of other people, which often leads to misunderstandings. Many people with autism are very fixated on certain rules, activities, interests, or rituals, and become angry when the daily routine is disrupted or when something in their environment changes. Some devote themselves almost obsessively to a particular hobby, collecting and reading everything about robots or dinosaurs or trains, for example, or becoming fascinated by house numbers or car number plates. Although people with autism share all these characteristics, the condition has many facets. Such statements like autists cannot recognize emotions and cannot understand social signals, or autists see the world differently and always have a special talent, do not reflect reality. Some people have an intellectual disability who cannot or hardly speak, while others have normal intelligence and are given the words very well. Nearly half of people with autism are mentally retarded. Only a small minority of 3% have above average intelligence. The symptoms can change over time. This often makes it difficult to mental health professionals to diagnose autism and to separate it from other conditions, such as depression or ADHD, which are associated with similar symptoms in children. It is also difficult to diagnose autism in adulthood if there is not enough information available on the onset of the disorder in childhood. Because the line between an autistic disorder and an odd character of a personality disorder is often not so clear. Many of the symptoms of autism also appeared in other disorders. The important and decisive criteria are that the disorder manifests itself in early childhood and that a combination of several clear symptoms are present. Science still doesn't know much about the causes of autism. What we do know from family and twin studies is that genetics play a major role by more than 90%. Environmental factors seem to play only a minor role, influencing the symptoms and other side effects rather than the disorder itself. Genetic abnormalities affect the development and functioning of the brain and thus also the behavior and mental functions. It seems logical that this is related to changes in the brain, but that has never been confirmed by research. The research results show that so far there are no specific anatomical features that occur only by people with autism. What we know for sure is that certain neuronal systems by people with autism develop differently. There are different connections in the brain which work also differently. Such anatomical abnormalities can be seen already in early childhood. Children between the ages of 2 and 4 with a diagnosis of autism have a larger brain size than their peers without problems. However, between the 6 and 8 years of life, the volume of especially the gray matter, the body of the brain cells, decreases again and then stabilizes. The maturation of the brain seems to proceed differently. As a result, autistic adults have a smaller brain size compared to people without autism. Brain areas such as the frontal lobe and the temporal lobe in particular show this atypical development and disrupted maturation. Maybe you will ask, does this sign provide clear evidence that a child has autism? The answer is no. These brain volume changes are common in people with autism, but they're like other symptoms that are not specific to autism. The abnormalities in the frontal lobe are also seen by people with schizophrenia. But when the spontaneous activity of the brain at rest is measured, we see a fairly consistent picture. There is reduced connectivity in adults with autism. There are few connections made between brain cells. There are also no changes that appear to occur in the attention network. Children with autism show a very different picture. The brains of autistic children seem to show too many or too strong connections, while autistic adults show too few or too weak connections. The tipping point probably lies in puberty, when drastic hormonal changes take place that also affect brain development. Scientists don't know yet what exactly happens in the brain of children and young people with autism. One thing is clear. Even in children with autism, brain networks change until they reach adulthood. For example, when healthy babies are not busy with a specific task, there is mainly interaction between brain regions that are important for learning through observation and for consciousness processes. The amount of white matter which is formed by the connections between the brain cells increases over the years. During growing up, the communication between regions of the brain that are far from each other becomes stronger. This process is disrupted in people with autism. Whether we look at the autism symptoms or at the brain functioning, age and developmental level appear to play a central role in both cases. There is also the difference between men and women. At this moment, few scientific studies suggest that the changes in the brain are related to gender, possibly because of the influence of hormones. The difference between peers with and without autism is greater in girls than in boys. It is still unclear whether there are differences in the brain between men and women with autism, or whether it's a matter of differences in the course of development. The problem is that women and girls are strongly underrepresented in most studies because autism is less common among them. In addition, many studies are performed with men who have normal or high IQs. Autism with intellectual disabilities are often excluded from the study. However, approximately half of people with autism have intellectual disabilities. In order to better distinguish specific symptoms and groups of symptoms, researchers are now also using artificial intelligence. The researchers train a computer program using extensive data collections, such as brain scans, to recognize connections and to make a diagnosis. Medical science has distinguished 3 types of autism until now. First is classic autism, which manifests before the age of 3. It is characterized by problems in communication, stereotyped repetitive behavior, language development, and motor skills problems. These people often have lower intelligence. On the contrary, in Asperger's syndrome, there are no problems in language development and development of cognitive functions. But are there still clear problems in communication and behavior? And finally, atypical autism does not manifest itself or distinguish itself until later in life. It differs from classic autism in the appearance of less symptoms. However, the most recent edition of a manual for assessment and diagnosis of mental disorders, the DSM-5, does not distinguish those 3 forms of autism. Now we use one term, autistic spectrum disorder, or ASD. It indicates that autism can manifest itself in many different ways, and that there is often a smooth transition between the different types. Unfortunately, there is no cure for autism, so a person has to live with it his whole life. I know it's a lot of information to take in, but I hope you enjoyed this video. I would love it if you would give this video a thumbs up. Feel free to express your thoughts in the comments below and let me know if you want to hear more on this subject. But also don't forget to subscribe, hit that notification bell and to share this video with your friends. Thank you very much for your attention. See you next time.